Folks, we'll open it up for questions. They were very disciplined. Thank you, gentlemen, for doing that. And I do ask that you use the microphone. I'll bring it to you. The reason is, no matter how booming your voice, we're taping this, and so we want to make sure we get everybody on tape as well. So, number one.
Senator Priest, the first bill that you discussed was the one that would join Montana with other states in challenging the health care law. What do you believe are your chances of, number one, getting this through the governor, and number two, if you do, getting the state attorney general, who is not necessarily a conservative, to implement this?
Just tap it once on the bottom.
How'd I do? First of all, majority of states have joined that lawsuit now, and that lawsuit is progressing, which is a good use of the term. I agree. Sometimes it's advancing. You know, there's precedence for this. About 40 years ago, the legislature came together on a bipartisan basis and passed a law that asked the Attorney General to join in a lawsuit. I would hope that Governor Schweitzer would see, you know, Governor Schweitzer has been critical of healthcare reform. He has said on a number of occasions that exactly what you've heard here today, this bill does not address the underlying problems in healthcare. He's also, his own department produced the Medicaid expenditure effort, the additional estimate of Medicaid expenditures about $175 million, and he's been critical of that program. So I would hope that, you know, at least one Democrat would join us and make this a bipartisan effort, since it's clearly what Montanans want to happen. He's been critical. He seems open-minded about it. Will he pick politics or will he pick policy? I happen to believe today this is good policy to join this lawsuit and to resist the implementation of Obamacare. It's probably good politics, so I hope he'll do what legislatures did 40 years ago, and when it's in Montana's interests, they'll put aside politics and they'll join us in this process.
I'm not so sure if this is a question or maybe more of a comment, but you were talking about the mandates that are in the insurance legislation now, and I'm an insurance agent, and I make my living selling health insurance. And you know, you mentioned the maternity mandate. There's also a mandate that we have unisex in Montana, which is very unusual. There's hardly any states in the union that do that. And so not only are 60-year-olds paying for maternity, but men are paying for maternity. And it's just absurd, the waste that it, you know, and how it raises the cost of insurance in Montana. I mean, we could have such a low rate if we got rid of these stupid mandates that are in the law.
Carl, could I address that?
Please do.
One of the bills we didn't talk about, because it's not a health care bill, is one that's being carried by Representative Liz Bangeler from here in Helena. And her bill takes and gets rid of the unisex provisions for auto insurance and life insurance. My bill for insurance across the state line, and the title specifically says that if you're buying a policy across state lines, you're not subject to the unisex provisions. So we're addressing that.
Yeah, I'd like to ask this. I guess it goes to Terry Smith. You were talking about House Bill 445, House Bill 183, and House Bill 184. 445 allows to buy insurance across state lines. First question I would have on that. First of all, I like those ideas. And I'm in the insurance industry. I've been in there for 38 years. I like the idea, but the first thing is, what's that going to do to the premium tax aspect of going across state lines? Are we going to have a problem? Is that worked out? Because I have a hunch that you're going to get a lot of the Democrats coming back worried about where their money's going to go. Same thing on the premium tax going into the policy to lower premiums. Another good idea, but you're going to have problems with the insurance commissioner up there worried about where their money's going to go. And the 7% credit on your Montana income tax, I like that also. But what I'm worried about, I guess, is the fiscal aspect, because I do know from past experience a lot of bills get killed over fiscal notes. You want to address how you're going to handle that problem?
Sure, I'd be glad to address that. These bills that we were talking about are down in appropriations right now, and I think most of them are going to come out. As you know, or should know, we just passed House Bill 2, and that's our budget for the state. Now, one of the things that we don't have represented well in that is tax cuts. And it was a hard sell to talk to people about that. And some of the fiscal notes are pretty high on some of these bills. For instance, the bill to buy insurance across state line, and the way we're handling those expenses on there, where half goes to the state and half goes to our state and half goes to the state where the policy is domiciled. But the fiscal note that came out on it was large, and they said that, and I didn't really know how to take the fiscal note. Either it was a really good idea because they said a quarter of the business would leave the state immediately, or they thought it was a really bad idea and they were trying to kill the bill. The reality is there's only one other state that's doing this right now. You know, the question comes up, are we more concerned about revenue to the state, or are we more concerned about taking care of the high cost of health care? These bills, sometimes you have people that are talking about they don't like tax credits. Well, this is money that you're paying into the government, and they're spending it how they want to spend it. They're using it for socialized health care programs and whatever else. So this is money you've earned that we're giving it back to you. This is your money. I'm just putting it back in your pocket. And we've had long conversations with our Appropriations Committee. Our leadership in the House is very supportive. We think we have the money to get those out. We're going to know in the next couple of days. But this is a top priority for us. And not only do we control the number of representatives on each one of our committees in the House, we also control the Appropriations Committee. So we don't think it'd be a very good idea at all to take and kill all of Obamacare and not have solutions for ourselves. So we're looking at that very hard, and I think we're going to do okay.
You know, I'm on appropriations, and we talked about that this morning. We were going through bills that we're going to be voting on this week, and somebody made a comment when we were calling out bill numbers. They said we might as well say Smith's bills. So they are coming out this week because we want to be able to send a comprehensive package to the governor for signature, not just piecemeal it one thing at a time.
I have two questions. First off, I'm new to this whole process, but why we have so many bills that seem to cover kind of the same information? There are several different bills that seem to kind of cover the same thing. And my second question on the tort reform bills, my husband is an anesthesiologist, and when you address tort reform, are you talking about reducing the amount of time that claimants can come back and file suit in your tort reform bills?
A lot of questions there. Let me start with the one that first, because I remember that the longest. The reason why we have so many bills is because, kind of back to that fiscal note, if I turned in one bill with a $40 million fiscal note on it, they'd go, ah, and that'd be the end of it. Also, if you have more bills out there that address little different things, the likelihood of getting something through, I think, is a lot better. This is all of my notes for all these bills we're talking about, and the bills themselves and additional. I don't know how many pages are here, but it's not 3,000. Okay? And so the less complicated we can make a bill, the easier it is to tell people about it so they can understand it. This doesn't take, let's see, Senator Shockley's gone, but it doesn't take a lawyer to figure out what's in these bills. Any of you folks can read it and understand what it's all about. The question on the tort reform, one of the bills takes and moves it back from 3 years to 2 years, but that's from when you discover that you've got the problem. So if you've had an operation 5 years down the road, you've got this funny lump that's doing something that you don't really like, and you go and you find out a sponge was left there, that's when the time period starts. Then we also have the review board that takes a look at it, so you've also got time that goes into that while they're looking at it. So this puts us similar to a lot of the other states on what we're talking about.
We have time for one more.
Hello, I'm disabled, I'm on Social Security, I got an Advantage plan. Advantage plans for people that are 65 and under that are disabled. 3 years ago, my Advantage plan had a $1,000 deductible. This year, it has an $8,000 deductible. I ain't got 8,000 bucks, I'm on a fixed income. My doctors now are sending me bills that Medicare reimbursed me for 2 and 3 years ago. This year they're not, because they said Social Security or Medicare lowered the amount that they reimburse the doctors now. So are we going to do something about the deductible on the Advantage plans so us people that are disabled can afford to pay our doctor bills?
Okay, that's one of the things Obama promised to do, was to eliminate the Medicare Advantage, and you're seeing the effects of it. That's what it's all about, and there's really nothing we can do about it from this point. We can, down the road, do some of the things that Cary Smith was talking about in terms of providing assistance for our own people in the state. But as far as putting any leverage on on Health and Human Services at the federal level, it's just not possible, really.
That was quick. We do have time for one more. Mary?
I was wondering if having Montana opt out of Obamacare and get a waiver like Maine did has been an option that you're looking at?
It's really important to, this is where it gets really complicated with the national news media. You can't opt out of Obamacare. You can find your own way to ruin healthcare as long as you meet their standards for ruination. And that's what Maine is asking to do. And I know that sounds really silly, but it actually is true. I'll give you an example. Vermont wants to use the money that they anticipate getting from the federal government to implement Medicare for all, what they call single payer system. So if you think that's a good idea, you know, President Obama thinks it's a good idea. That's what he wanted in the original bill. He couldn't get it done. So you can go that road, and that's what I meant when I said early in the process, and everybody's kind of echoed that, is as long as you meet their objectives, or you want to do something more ambitious, you can, but you don't get to create your own health care under Obamacare.
That's similar to the exchanges, that the exchanges provide more choice, right? And opting out is an option, right? Well, the exchanges provide choices within a very narrow band of options that will not improve the system at all. In fact, will make it worse. And if you want to opt out, you have to opt out into, as Senator Priest said, your own version of ruination. Gentlemen, any parting shots?
For us, and frankly, they provide news stories that the media doesn't want to take the time to write, and I appreciate it very much. It helps us. So thanks, and we need to get back to the floor.
Thank you, gentlemen. All right, while they're clearing out, we're moving into the second part of our program. Up as well, and that's why we want to do this. A couple things I forgot to mention. There's a survey form in each of your packets or on the things on the tables. Please fill those out if you have a chance, and let us know how we're doing and how we can improve these programs. Also, you each have a name tag. There's a reason for that. It's not so I can look at it, it's so you all can look at it. This is about networking too, and getting to know, getting familiar faces, putting names to faces, and hopefully we start seeing each other more at more meetings and things like that. We're going to start doing more of these over time, and so again, hopefully we'll have an opportunity to get to know each other a little bit better, and we'll know who each other are. All right, second part of the portion here. We are very, very